Dr. Sauer of the Longevity Center at St. Vincent is here to tell us more about Lyme disease, what to watch for, and how you can protect yourself. Good morning to you, Dr. Sauer. Good to see you.
It's great to see you again.
Okay, so we think about Lyme disease, we automatically think about a tick. In fact, I pulled a tick off my daughter not too long ago, and I knew that she had Lyme disease. So I'm so glad you're here to explain what we really need to look for, and not every tick is going to give you Lyme disease. I've learned since then. Okay.
Thou shalt not panic. You're probably safe.
Okay.
The most important thing to do is obviously to try and protect yourself first. Wearing long sleeve clothing, tucking jeans into boots, especially if you're going to be out in tall grasses or wooded areas. Be sure you get your pets taken care of for ticks, and obviously being sure you watch. So you watched your daughter and you found the tick. It's amazing how low the incidence of Lyme disease is if you get that tick off within 48 hours. That's 2 days. So if you get that tick,
surely you're going to bathe within 2 days, right?
Exactly.
Surely. Okay, is a tick the only way you can get Lyme disease?
Pretty much the only way you can get Lyme disease.
Okay.
Most reasonable way is going to be through that.
Okay, so what should we look for if maybe we do find a tick later on that we didn't catch in the beginning? What should we be looking for?
First of all, there's going to be kind of a non-generalized syndrome, as I call it. You may feel achy, fever, joints hurt, your muscles hurt, and then classically with Lyme disease, but not always, is there's a rash. It's kind of a red circular rash.
Okay.
And so you want to look for this, especially around the site of the tick bite.
Okay.
Fever can accompany this. You may not have symptoms in the first week or two, and you may go into other symptoms later, such as having hepatitis, having difficulty with the kidneys, having some irregular heartbeats or eye problems that can develop even weeks to months later.
Sometimes diagnosing this can be difficult because of all the other symptoms that go along with it.
Sometimes it can actually truly be a nightmare. There's a lot of controversy over this with the Infectious Disease Society of America and some of the recommendations on how to diagnose this, because the test comes back positive or negative, but the one test has about 16 components to it, and so you really need to look at all of those components and see, all right, are all these positive or all these negative? How does this work? So there is some controversy over that right now.
Certainly if you start to feel some of these symptoms, you should think back, have you been in an area or in a situation where you could have been bitten by a tick, right?
Yes.
So you can tell that to your doctor.
Absolutely. Have your doctor look you over. Are there, did you see any tick bites? Did your family see any ticks? Did you take any ticks off of you? And so taking a look at that and having a common sense approach. A blood test is quick, it's easy, it's not going to be harmful, and fortunately the treatment for Lyme disease is actually very affordable. Some of the generic antibiotics will do a fantastic job, both for children and adults.
Let's talk about the treatment, because oftentimes we've heard that Lyme disease can be deadly even.
Yes.
Talk a little bit about the treatment and the prognosis of someone who does get Lyme disease.
Prognosis is actually very good, especially if caught early on. Like I said, you can use a few weeks of several generic antibiotics and get this problem taken care of. If this is allowed to go for a long time, you may actually have to take several months of oral antibiotics, sometimes even in combination with IV. But again, not that terribly difficult to do with modern medicine.
And how common is Lyme disease, particularly here in Arkansas?
We're actually blessed. Lyme disease is not very common in Arkansas at this time. It's more going to be the Northeast and the upper Midwest. So if you go into these areas which are endemic and then you come back and have these problems, you certainly need to be checked out. However, Arkansas does have its own variations, including ehrlichiosis. It was actually first discovered at Fort Chaffee, just outside of Fort Smith. And so ehrlichiosis is a very similar syndrome. They're very difficult to discern between the two, but a blood test does that. So I do look for Lyme disease in some of my patients, but ehrlichiosis is another one that's really important.
More common here in Arkansas. Go get that blood test if you have these symptoms or are concerned that you may be suffering with Lyme disease. Again, the treatment is affordable and pretty easy. Dr. Morgan Sauer with the Longevity Center at St. Vincent. Thanks so much for being here. Great information. I feel much better now. I don't think my daughter has Lyme disease after one bite from a tick.
She'll be fine.
Yeah.